Okay, we're going to get started. I'm Eric Bruns. I am here from the, I got to turn off my chat because it makes me laugh. Joining you from beautiful Washington State. I'm based in Seattle at the University of Washington in the Department of Psychiatry and the School of Medicine at the UW, and I have a wonderful team, several of whom are with us today, who I'll introduce. But I am a professor at the University of Washington and a director of the National Wraparound Initiative with Janet Walker, and a co-director with many wonderful people of the National Wraparound Implementation Center. I'm going to briefly just say who is going to be presenting today and let them introduce themselves when they get on for the interest of time and efficiency. But from the University of Washington team, which hosts the Wraparound Evaluation and Research team, is Philip Benjamin, our research study supervisor, and Jonathan Olson, our wonderful research scientist. And so along with me, we're going to be presenting with our colleague from the University of Maryland School of Social Work, which is the second of 3 academic institutions that comprise the National Wraparound Implementation Center, or NWIC. And that's Shannon Robeshaw, who you can see on your screen here as well. So thanks so much to the University of Maryland's team, Sarah and others, for getting us set up here today. What we're going to be talking about, and this is under the auspice of the SAMHSA-funded National Training and Technical Assistance Center, or NTAC, or the, as we actually like to call it, the Technical Assistance Network for Children's Behavioral Health. This is a session that's going to be focused on establishing a framework for wraparound fidelity assessment using principles of implementation science. And you can see, again there, that this is folks from both University of Washington and University of Maryland. Go ahead to the next slide. Just do our full acknowledgement. This is hosted by the National Wraparound Implementation Center, which is a partner in the National TA Network for Children's Behavioral Health. And this is prepared for and as part of the SAMHSA-funded TA network. Okay, so what we're going to do today is something that's near and dear to our heart that we've taken on with greater and greater intensity over the years, which is to inform the quality improvement and implementation of wraparound using principles of implementation science. So what we're going to do today is talk a little bit about how implementation science serves as a foundation for measurement in wraparound and behavioral health. We're going to review measures of wraparound fidelity, many of which you all are probably familiar with, and others you may be less familiar with, and talk about how they actually fit within a framework for implementation of wraparound and for any kind of innovation. So that's our main agenda. At the end, what we're going to do is we're going to present some examples of how using a consistent framework based on implementation science really benefits wraparound and the field of youth behavioral health by presenting some lessons learned from our fidelity and implementation measurement using these tools and this framework. So that's our agenda today. Before we start, can we do a poll? Let's ask who is here. We're going to give you 1 minute to just pick your the role that most resembles the role that you play in children's behavioral health and wraparound. Sarah, are you ready to launch that poll for us? It's always kind of interesting to see who joins these kinds of sessions that we put on. Are others seeing the poll? I'm not seeing the poll, but it might be launched for the attendees.
Sarah mentioned in the chat box that her internet was being slow, so I don't know if she's having trouble launching the poll.
I think that Chelsea may have the ability to launch it as well, so I'm hoping that one of them will launch it here in just a minute.
All right, well, why don't we keep going so that we don't lose time? And if we can launch it, we'll just pause whenever it gets launched. So go ahead to the next slide there. So while we're waiting for the poll, or I mean, it's not really critical that we do it, but it's nice to know who's joining. I'm going to talk a little bit about wraparound and implementation support over the years. We've heard a whole lot of folks over the years talk about, including myself and many others, kind of reference the criticality of wraparound fidelity. So doing wraparound as it's intended, adhering to the principles, adhering to the phases and activities. But what folks don't often think about, I get paid to do this on a daily basis, so I do think about it, is how the evolution of wraparound and its implementation out there in the world went from just a good idea to literally every single state in the country and over 1,000 wraparound initiatives across the country. In the beginning, when it was kind of just a new and radical idea, implementation science would say that we were at the phase of diffusion. We were basically putting out best practice examples, maybe some descriptions of ways in which some of the early innovators of wraparound did it in their corners of the world, in Chicago, in Alaska, in Kentucky, you know, folks like John Vandenberg, Lucille Eber, Pat Miles. We were getting that information out there. And because implementation science really wasn't a thing yet, you could kind of call that letting it happen. We were putting out examples out there for the field about what this idea was about, doing whatever it takes to keep kids in their homes and community, and hoping that it would happen. Over the years, we realized that folks who were taking up that kind of charge were often experiencing greater frustrations than they perhaps had thought that this was going to be, that there was going to be. And so we kind of kicked up our game a little bit, and we created practice models, we created manuals, we created fidelity tools. You know, my experience with creating fidelity tools goes back to the early 2000s. That was kind of an era of dissemination. We were getting the information out there, we were putting tools out there, and you could say that we were helping it happen. That's kind of what dissemination is. What we are trying to do now at NWIC, which has been around for about 8 years as a formal entity, is something that goes beyond diffusion or dissemination in the implementation science world, and that is true implementation. And that means making it happen. The tools that we're going to talk about today do indeed measure the quality and fidelity of wraparound, but there are also tools and measures that help folks provide hands-on coaching at multiple levels, at the system level, at the program level, and at the practice and supervision level. Having those kinds of data and using them to provide hands-on support, coaching, and technical assistance, using data to guide the way is true implementation support using measurement, and that's really making it happen. All right, go ahead to the next slide, Philip, but I do think we can launch the poll now.
We can launch the poll.
Excellent.
All right, launch it. Let's find out who's in the room as we continue here.
And just want to note, the poll is in the chat box, or not in the chat box, but over to the side on your screen. So that's where you want to look for it.
We know a lot of people wear a lot of hats, so pick the one that best describes what you do. Sadly, I don't see researcher and evaluator here, I don't think.
It should be on
but
there.
I will. What's that?
Research and evaluations, letter 0.
Oh, I got to scroll down. Okay, so note that you can scroll down. There's a whole bunch of options. There we go. And you can also feel free to talk about what organization you work for and what it's best described as. Thank you, Shannon. Maybe others were having that problem.
You must submit when you're done for it to be counted.
Yeah, and then hit submit. Hey, Loudoun County. That's close to where I grew up. All right. So let's give folks about 5 more seconds. You can go ahead and go to the next slide if you like, Philip, while we're getting people to finish up. Looks like those are 2 separate things. Okay. All right, before we talk about our framework that we use, let's look at our results here. My goodness, we have 335 people who actually joined today, which is just extraordinary. Looks like we got 45 supervisors. We have 125 folks provided no answer, but the biggest, the modal response is executive directors, executive leadership, supervisor is up there. What are some other roles? Wraparound provider, staff, a lot of researchers and evaluators. So that's cool. These data and the slides themselves will be available on the National Wraparound Initiative website, just so you know. And your organization that best characterizes our attendees are state, territory, tribal, or local mental health is what it looks like.
Mm-hmm.
Okay. So thank you for doing that. That'll help us a little bit with knowing who's joining our events over the that we hold. Okay, so I'm going to close my own polling box here. So this is the framework that we use, the kind of implementation science-based framework that we use to try to organize ourselves as we deliver direct training, technical assistance, and full-on implementation support that makes it happen. It's not letting it happen. It's not hoping it happens. It's making it happen. It's the Consolidated Framework for Implementation Research, or the CFIR. The CFIR organizes critical constructs associated with successful implementation into one holistic kind of framework. And this is our kind of preferred approach to presenting the CFIR. There are other ways. Now, one thing I will say is that there are a lot of frameworks out there. There's a recent study found over 200 different implementation frameworks. You go to the next slide, Philip. This is my favorite nerdy implementation science joke, which is we got to remember that we could have picked any number of frameworks. Frameworks are like toothbrushes. Everyone has one, and no one wants to use anybody else's. So everyone creates their own framework. We prefer to use the CFIR because it does pull from all of the frameworks that were available at the time that it was created, which is why it's consolidated. Go ahead to the next slide. So we choose to use the CFIR because it also kind of reflects a lot about what we know about wraparound practice and necessary implementation support conditions. And I'm going to put it this way really quickly, and then we'll get to the measurement piece of this, that in the CFIR, the ultimate right-hand side of the diagram is outcomes. We're trying to get to positive child and family outcomes. Why is it that we need, what is it that it takes to get there? We need to have good implementation of the practice model, whether it's wraparound or MST or successful healthcare. So we measure implementation of the innovation as one factor that leads to outcomes. But as we know in children's services, there are so many other things that drive whether or not we can do this work well and whether we get to positive outcomes. So we're talking about within that circle on the left-hand side, what's the characteristic of the intervention? So is wraparound something that's easily done by practitioners, or MST or trauma-focused CBT or any other of the hundreds of interventions out there? What's the characteristic of the intervention? What are the characteristics of the practitioners or the team that are implementing the intervention? What is the inner setting all about? One way I'd like to revise this kind of pill diagram is to put the inner setting kind of as a circle within the outer setting surrounding these other issues, because that is kind of the way it's nested. We have organizations nested within the policy and finance conditions, and that's that last blue thing out on the outer setting, on the outside, is the outer setting. And when we talk about the outer setting, we're talking about policies, money, financing rules, what can you get reimbursed for? Do people come together to actually collaborate in a system of care? All of that represents the really critical outer setting. So that's it in a nutshell. You go to the next slide, Philip. These are the kinds of main points in the CFIR that we also have measures for, each of these types of things. The outer setting, again, external policies, funding availability, and rules, which subsumes everything within it, including organizations. In the implementation science jargon, that's the inner setting. What's the organizational culture, climate? What are the supervisors' caseloads? How ready are folks to implement this stuff? Are they being trained? Are they coming into their roles with good readiness to implement? Then you've got, again, the intervention characteristics. Is it too complicated to do, or is it simple to do? Is this something that you can adapt to your organization, or is it extremely rigid and something you can't change if you want to implement it? Then you've got individuals, and you've got the implementation process. That's a critical thing that only recently is being really afforded a lot of attention in the measurement, is how do we know whether or not that making it happen, that full implementation, is something that is proceeding as we know it needs to, the implementation process. Okay, next slide. Just throwing out another framework, the EPIS framework, just to reinforce that there are so many other relevant frameworks out there that we could use, but we choose to use the CFIR. If you look at all of these other hundreds of implementation frameworks out there, you will see similarities across all of them and differences. but we also often refer to the EPIS because it's got bridging factors in there that represent the thing that we think is so critical, like state centers of excellence that get from the outer context to organizations' capacities to do innovations like Wraparound. All right, next slide. Hey, so let's launch a poll if you're able to really quickly before we start talking about our measures and hand it over to Philip. Sarah, if you're able to launch the poll, the next one is about your organization or wraparound initiative. So some of you might be really fluent in this language and therefore you probably thought about this stuff before. For others, it may be a new bunch of stuff, but based on your current knowledge, whether it was just introduced to you by me or not, what are the things that you currently measure in your implementation of Wraparound? Do you measure outcomes? Do you measure fidelity? Do you measure the process of implementation with actual tools, the implementation planning, the executing? Do you measure your the individual characteristics of your practitioners and family partners and care coordinators, you know, what their knowledge and beliefs are, what their stage of change is, their self-efficacy? Do you measure stuff about your climate and culture and other things about your inner setting? And finally, do you actually have measures or something to capture the degree to which your policies and funding is hospitable to Wraparound, the outer setting?
And I just want to
yeah, go ahead, Philip.
Eric, really quickly. You can select more than one of these, and that's intentional in this. It's not just a one or the other. You can check as many boxes as you feel is appropriate.
Yeah, this will be a really interesting little mini research project, so do please complete this poll. Out there in the Wraparound world, what in the implementation ecology are you actually measuring? You know, be honest. We want to see, this could be the basis for work the National Wraparound Initiative does in the future to know what people are and aren't consistently measuring. All right, should we see what our results look like? Interesting. So some people didn't answer. Some folks are multitasking or don't know. That's totally fine. But what we see is that there really isn't any one domain that more than half of the respondents say get measured. So, you know, only about half of folks say they do outcomes. About a third say they're doing fidelity. About a third say they're measuring implementation process. And then maybe this is not surprising, but individual characteristics, organizational progress, and outer setting are all down there at perhaps a quarter to 20% of folks out there in the Wraparound world. So thanks for doing that. I'm going to hand it over now to talk about the measures of these different domains, and I believe I'm handing it to Philip.
Yeah, thanks, Eric. So I'm going to take over from this point for a bit, and then we'll pass it to Shannon briefly. But I just want to go ahead and do my best to kind of explain how, you know, each of our tools and our measurement systems fits into the implementation process, kind of by using the CFIR model framework to help us understand that. And so right here, we're going to go ahead and start out by talking about two tools that we use for training and coaching, and then kind of explain again, how do they fit and where do they fit into that CFIR model. So we see that the IOTA targets the individual characteristics. Well, I'll first describe what the IOTA is, which is it's the impact of training and technical assistance. And it's something that we use for, you know, an intro to wraparound training or a, you know, intermediate level wraparound training. And it's something that we give immediately post-event, and then we follow up, we do a follow-up for in-person events as well. And it focuses on the perceived quality of training, the intended use post-event, and then the actual use in the follow-up. And then also with the coaching observation measure for effective teams, the COMET, we see that that's used by supervisors and coaches to assess the wraparound practitioner's mastery of skills necessary to ensure high fidelity wraparound. And it's also used by national coaches to train local coaches. And they do that by kind of comparing their scores and seeing how well they're in alignment. So right here, we're going to go ahead and come right back to the CFIR model. And we see that the IOTA is targeting certain parts of this process. It looks at individual characteristics by measuring kind of the self-rated knowledge and beliefs and sense of efficacy, kind of based on a training. And we see it also looks at the process by evaluating kind of the sense of satisfaction and perceived impact of a training. And then the COMET is bridging both the intervention characteristics and the individual team characteristics. And we see that as far as individual characteristics, it's measuring the knowledge of the process by the local coaches and the wraparound care coordinators. And it's also looking at these intervention characteristics by helping to determine the level of fidelity of wraparound that's being practiced. So next, we're going to look at the fidelity measurement, the WFAS tools. That's the Wraparound Fidelity Assessment System. And we're going to look at several different tools, and I'm going to kind of, again, describe how each of them fit into the CFIR model. So first, we'll look at the Wraparound Fidelity Index Measure. This one's probably the WFAS. It's probably the most widely used tool that we have, and it really looks at kind of sense of satisfaction and fidelity. We see here initially, there's some items that look at demographics, wraparound involvement, who are the people involved in the process. The bulk of the WFAS looks at key elements of wraparound, and then we have a little bit of satisfaction and outcomes. It's something that can be administered to caregivers, it can be administered to the youth, to other people who are involved in the process, and also it can be done by care coordinators. And it's basically kind of a survey format. Next is the Team Observation Measure, the TOM 2.0. And this is really an interesting tool because it's very focused on the evaluation of the fidelity of a specific child and family team meeting. It's looking at just a little window of that process. And it's really can be an effective tool, whether it's done from a live child and family team meeting or whether it's a recording of that, it can be used as an effective tool for coaching. And we look at within this tool, full meeting attendance. Again, the bulk of the tool is geared towards are these wraparound key elements occurring? And then it looks at the skilled facilitation by the care coordinator of that meeting. And then finally, we see the document assessment and review tool, the DART. And this is a pretty comprehensive tool because it looks at the entire process of wraparound based on kind of the written record and the notes that we see. It starts all the way in the very, very beginning with timely engagement, looking at the referral process, how quickly wraparound starts up. It then moves through, to what level is wraparound being practiced with fidelity with these wraparound key elements. It looks at safety planning, crisis response, and it kind of finishes and ends at the very end of the wraparound process, looking at transition planning and outcomes.
Yeah, if I might interject real quick, Philip, one thing that we've learned along the way with our fidelity measures is that a lot of folks have been really keen to measure fidelity and struggled to get to outcomes, even though they were collecting data from like the Wraparound Fidelity Index pretty consistently. And so, one thing that we've really learned is critical as a evaluation and research team is to incorporate items about satisfaction and outcomes into our fidelity tools so that those data are all available in one place and can be assessed on a regular basis, such as through the WFAS surveying. There are these real bottom line core outcome questions as well as satisfaction and fidelity questions. And the DART really does take advantage of the fact that you might be investing an hour or more reviewing your EHR or your documentation to ask, what was the quality of implementation? Let's also ask what the record says about the outcomes that the kids got as well. Sorry about that, Philip.
No, absolutely. And so we see when we come back to the CFIR model here, where these tools are falling, and that's in the measures of fidelity and implementation success. And so with that, I'm going to go ahead and move on to the next session, and I'm going to go ahead and pass this over to Shannon.
Hi there. Everybody hear me okay? Okay, y'all can hear me? Okay, good. All right, so yeah, so we've been talking about that CFIR framework and the different ways to look at implementation support. And we've been focused a lot historically on the fidelity measures traditionally, but really there's been an increased recognition. I mean, I think we've always recognized it, but I think it's been a little more focused recognition on the need to be looking more at the outer and the inner settings in terms of program and system. So just recently within the past, I guess, year, 18 months, 2 years at the most, NWIC and WIRT have been looking at some additional tools to try to begin to do that a little more deliberately. And so we've developed the Wraparound Implementation Standards System tool and the Wraparound Implementation Standards Program tool. One to look at the system, one to look at the provider implementing organization, and then the Wraparound stages of implementation completion tool. I'm going to spend a few minutes now talking about the WIS and the WISP tool, and then turn it back over to, I think, either Philip or Jonathan to talk about the SIT tool, which will measure the success of an implementation related to when certain particular activities are accomplished. So let's go. Okay, great. So, in 2016, the Wraparound Implementation and Practice Quality Standards were published from the work team. This came out of, again, that increasing recognition that in the literature really saying that the outcomes for Wraparound really are highly dependent on program and system factors, not just fidelity implementation and measuring those fidelity indicators. So system factors like, do we have the right eligibility process to make sure we're capturing the right population of focus in the programming? Do we have sustainable long-term funding? Does it provide enough of a rate, an adequate rate to really support the practice model as we know it should be implemented with the staffing ratios you see here of 1 to 10 used for care coordinator and supervisor also having low caseloads. Internal provider organizational approaches towards hiring, onboarding, training, recruitment, skill development. And then those system policies, both at an organizational level and at a larger system level, that really do proactively promote wraparound implementation in a quality way, and that really create policies and individual climates within an organization to where it really intentionally restructures itself to support an effective wraparound implementation versus just sort of keeping the status quo, making additional burdens for a quality implementation. So as a result of that process, so the work team took a good look at the implementation science framework and then also the actual evidence available from research on effectiveness of wraparound to date. And through that process, they came up with 7 areas that were clearly needed to be attended to if you're going to implement wraparound with quality and fidelity and get good outcomes. And so the 7 areas are 4 wraparound provider level, 1 competent staff, 2nd effective leadership, 3rd is facilitative organizational support, the 4th is utility-focused accountability mechanisms. The key word there, I think, is utility-focused, something you can actually use to actually guide the implementation. There was 1 area around at the wider community level, which is the hospitable system conditions, and then 2 output-related areas: fidelity, high-quality practice, and then outcomes. So it was these 7 areas that they tried to drill down and create very specific indicators, and they came up with 43 different indicators across those 7 areas. And so those standards were published in 2016. They're pretty straightforward, but what we found was, we at NWIC in our coaching and training and primarily coaching relationships with the states that we work with, wanted to take it a step further and really operationalize these standards. Next slide, please. And so we created 2 tools. We created the Wraparound Implementation Standards System tool and the Wraparound Implementation Standards Program tool. So these were created really to operationalize the standards. We put them across 3 different phases: pre-implementation, which is ideally before you start partnering with families at all; implementation 0 to the first 9 months of implementing wraparound; and then sustainability, which ideally would be achieved within 10 to 18 months after initial implementation. So the tools were created to track progress over time. They're meant to be, very clearly, this is not meant to be, we do have a score sheet, I'm going to talk about that in a minute, but these are not intended to be a report card in any way. These really are intended to be, we use them as coaching tools in the states and communities we work with. They can be used as a self-assessment tool on your own, but they're really meant to guide the planning and implementation process. It's not meant to be keeping score in any way, really. So I just wanted to give like an example of what some of these indicators are. And again, this is just one, I'm going to give you the first page look at the system tool and the program tool, just to give you an example. But both of the tools, they're not especially lengthy. I think the system tool is 5 pages and the program tool is 7 pages. But they've got indicators that really do represent all those different 7 areas that were identified in the practice standards, and we're trying to operationalize those. So one example here, and the system tool is very deliberately taking a system of care approach. It's not looking at implementing wraparound just as another program in some public agency. We really do know that to do well, we really do have to have that true system of care approach. And so an example that I have seen a lot is that, there's not always a thoughtful, proactive process for a readiness process that includes, and I'm just pointing out, I can't move my pointer. I see I'm doing it on my screen, but I'm sure nobody else sees that. But if you look at this, if you look at the red column, that's the pre-implementation column, and you look at the second indicator down, it says system has developed an implementation readiness process that includes a clear system design, leveraging of existing reform or financing initiatives, and assessment of strengths and gaps in the current system of care. So that's extremely important to understand what your system currently looks like, what's missing, where you're trying to get to. And it translates over to, in the yellow column, which is the implementation column, where you see like the first one is system leadership is working to operationalize a system design. Well, you can't operationalize a system design unless you actually have a system design. And then it also continues on to build needed infrastructure and establish financing mechanisms. The second one says it's working to develop the service array and the provider network to fill identified gaps in the system of care. And then if we see over here in sustainability, the first one is infrastructure is in place or design is being actively modified in partnership with stakeholders based on data and leadership identification of needed adjustments. And the second one says provider network and service capacity is regularly monitored. An array of services and supports is on target to adequate development. So you can see we've taken what we know from the research and the practice standards, but also our own experience with states and communities to really try to be very concrete about what needs to happen when. And if you miss any of these things, you're not going to get where you want to be in the sustainability phase. So, and so the setup is similar for the WFAS, the program tool. I'll look at that for a minute. But I would just say that we'll talk about how y'all can access these tools as well. But we really recommend that no matter how long you've been doing wraparound or where you're starting from, if you're going to be using these tools, you start with the pre-implementation phase, because there's some foundational stuff in there that if you don't attend to early on, it's going to disrupt your implementation. You're not going to get where you need to be. So let's move to the oh, and then just one other note before we. This is fine, but so one of the sections on the system tool also talks about the role the system has in sort of creating that hospitable environment, but it also talks about its relationship with the implementing programs and how the system leaders can provide support, leadership, structure, accountability mechanisms. What is the role of the state system in working with those local provider organizations to fully support them and give them the support and the tools that they need? Because some decisions that impact the ability, as we just have been talking about this whole time, for a good implementation on the ground, really the decisions are made at a much higher level within the system. And so you have to attend to both of those things. All right, so here's again just the first page of the program tool, and I'll point out just another example of kind of how things progress. So we've got enrollment, I'm on the red column down at the bottom where it says enrollment engagement. Procedures and policies are in place to manage referrals after initial eligibility. Then we go over here and we have appropriate population in the yellow column, which says youth and families enrolled meet all of the criteria of medical necessity and complex behavioral health needs for wraparound. So you're actually, your appropriate population is being captured. Your eligibility processes are standard and are standardized and effectively, capturing the folks that you want to bring in to work to partner with. And then if you look down here, we start looking at accountability mechanisms under implementation. And there's a whole list of other accountability mechanisms in this yellow column on the subsequent several pages. But there's processes in place to track child-level outcomes for all youth in wraparound. My little bubbles are popping up. I can't read the last one on the bottom, but there's a number of things. And then finally, when you get over to sustainability under accountability, you see you have a full, very robust CQI process, which measures outcomes, quality assurance, and it's, I'm sorry, my screen's clicking up, but it's a full CQI process that looked at outcomes, fidelity, workforce stabilization, quality and outcome measures, and all of these. So again, it's making sure you're doing your legwork on the pre-implementation before you start seeing families, then attending to know what we know you need to attend to during the actual implementation phase and getting those processes really shored up and solid, and course correcting through deliberate feedback loops that are set up to inform that process. And then at the end, hopefully you'll have a very solid and robust accountability process that you actually use to help guide the implementation. So these tools were designed to be used together. So in some of the experience we've had so far with working with some of the states we've worked with, we've done WISC level tools and then the WISP program level tools, and ideally they would be reflective of each other. But what you can find sometimes is there is sometimes a disconnect, and sometimes from system leaders have thought that they've been clear about communicating things or providing certain supports, but they may not have made it all the way down to the program level. And so it really is informative to be able to look at the two together and kind of be able to have a more full picture of things that could be addressed. So we have these tools. We have this electronic score sheets. They're just, basically spreadsheets, but it allows you, we advise scoring these quarterly and through the pre-implementation, implementation, sustainability, and they'll give you automatically generate little reports about what percentage you're at on some of those, on the categories of the different indicators. It also lets you push a button and get a cute little bar graph so you can have a visual representation of that. And you get those both at the system level and the program level with.
Excellent. I think this is, if we don't mind, I think we can move on to the SIC at this point, unless you wanted to have anything else that you wanted to finish up with.
I needed to say two more things. Awesome. One is that there's a manual that have been developed with each of these tools, because even though these indicators are pretty concrete, they require a lot more explanation for people to really understand how to score them. And so the manual is not that long, but it's very important. And these things are available for free. So we invite you to use them. We'll make them available to you electronically. They're free, they're no cost. We do need a signed licensing agreement and a data sharing agreement, because we want to be able to start building a national database to kind of see where different implementation efforts are and get some national benchmarks. So my email is at the last slide, I believe, on the deck. And so if you want to get the manuals, you need to just email me, Shannon Robshaw, and we'll get the process started. Thanks.
Excellent.
And we will have other support materials, as well as the slides and the recording of this, on the National Wraparound Initiative webinar archive site. So National Wraparound Initiative, Just Google it, and you'll find this as well as past webinars. One last thing about the WISP and the WIS. We need to figure out how to rename them so that we don't like confuse them. WISP and WIS sound a little bit too similar. But one of the reasons the manual is so important is that we need to score these consistently, because as you'll hear at the end, we have the wonderful opportunity of not just using these tools as coaching and technical assistance supports, but also as something that will facilitate research on what predicts success, or what predicts pitfalls or lack of success in wraparound implementation, which frankly is all about system of care implementation, because we view wraparound as being a system intervention as much as a youth and family intervention. So having those kind of scoring rules and adhering to them is also important for us to use the data that we collect to inform the field of implementation science and kids' mental health. All right, on that note, I'll hand it back to Philip to talk about another implementation measure.
Yeah, so I'm going to talk a little bit about the SIC, which stands for Stages of Implementation Completion. And that was something that was developed initially by Lisa Saldana, but which we've adapted with our NWIC partners to Wraparound. And you'll see here that similarly to what Shannon was talking about, we look at this across phases, right? And we see that we look at the pre-implementation phase. Are we set up for success? We look at the implementation phase. Are we addressing barriers, establishing clear expectations, and providing adequate support? And then finally, in the sustainability phase, are we ensuring that all good work is maintained and that we have CQI in place to monitor? And what's interesting about the SIC is that it breaks it up across these categories. So we have these phases, the 3 phases, but we also have stages that fall within each of those phases. And then those stages themselves look at the involvement and the participation of different levels of the system. So we see, for instance, under the pre-implementation phase, we look at engagement, consideration of feasibility and readiness planning. And mostly the people that are involved at that point are higher up. We see system leaders, and we see maybe people at the organizational or agency level. And then during the implementation phase, we have staff being hired and trained, fidelity monitoring being established, services and consultation, and then kind of ongoing feedback and fidelity. And that moves much more down into the agency, practitioner, and even at the client level. And then finally, during sustainment, we look at this kind of competency and certification. And for that to occur and for the kind of the gain to be maintained, it really requires people at all levels to continue to work on that. Something else that's interesting about the SIC is that there's these different scores that are generated. We look at duration, how long it took in each stage to kind of complete the different portions of it. We also look at the proportion of activities that are being completed within each stage. And then finally, we have a stage score, which is the number of full stages that have been completed. And the nice thing about the SIC is that there's a lot of predictive ability of it. Based on your duration and proportion of stages completed in the pre-implementation phase and in the implementation phase, we can kind of predict the level of sustainment success. So here, we bring it back to the CFIR model again, and we start to place these in their correct place within this framework. And it makes sense, that the WIS, the Wraparound Implementation Standards System, that would be looking at the outer setting. And then we see that the WISP, the Wraparound Implementation Standards Program, we're looking much more at the inner setting in that. And then finally, the stages of implementation completion, it's really looking at that process, right? And it's heavily drawing from the WIS and the WISP. Many of the items that we chose to include in the SIC are directly pulled from that. Okay, now this is kind of like the overall view of what we've been talking about so far in this process. We're trying to tie this all together. One of our big goals for undertaking this presentation, this process, was to help people understand how, using the CFIR model and looking across these different stages of implementation, the pre-implementation, the implementation, and the sustainment, where do these different items, these tools, these measurements, where do they fall? And we see that some of them happen at only one phase, and many of them kind of span all phases of it. And we also see that the frequency and ways in which a measure should be used may vary depending upon the implementation phase. Okay, and now we're just going to zoom in here and just take a quick review of kind of each of these phases. So again, here we see in the pre-implementation phase. These tools are really looking at and helping to determine if the state or the organization and the program, are they ready for wraparound implementation? And they're used kind of continuously throughout the process after this pre-implementation phase. When we move into implementation, we see that the COMET begins to be used for coaching. We see that these fidelity measures are moved in and begin to evaluate whether or not wraparound is being practiced to high fidelity. And then finally, in the sustainment phase, as Eric mentioned, we start to look at outcomes, and we start to see whether wraparound is really working and working for the youth and families, which is our ultimate goal.
It's important to note that you might very well be measuring outcomes even at the beginning of your reboot of wraparound when you engage NWIC. Many of our states and systems of care are in that kind of situation where you have those outcomes data pre-implementation of wraparound or kind of reboot, doing more extensive training and support to your workforce, such as what NWIC provides with its training and coaching. But when we're kind of talking about the evolution of what we're really focusing on, like Philip is saying, the relative emphasis may shift as you go from pre-implementation to initial implementation to sustainment. So it's a great way of presenting it, Philip. Thank you.
Yeah, and so at this point, I'm going to go ahead and hand the presentation over to Jonathan Olson, our research scientist, and he's going to kind of wrap things up and talk about kind of now what we've been able to accomplish using some of these measures.
Yeah, and John, maybe just a quick pause just to let folks know we're going to go a little bit past the top of the hour to talk a little bit about lessons learned and why it's so great from a research level to use a consistent framework in our work with many states and systems of care at the National Wraparound Implementation Center. But just to hit a couple of questions that came through as we were reviewing the measures, people were asking about the fidelity tools and whether they're considered different evaluation methods. They are different ways of assessing fidelity, the TOM, the DART, the WFAS, but they benefit from different types of perspectives. An observation of a team meeting versus a direct surveying of parents, caregivers, and youth, for example, review of documentation in the case of the DART. So they are different, but they are all tied together by all relating to the same 5 key elements of wraparound that are promoted by the National Wraparound Initiative. So that's a kind of thumbnail answer to that. There are costs associated, indeed, a couple people asked that, with licensing use of those fidelity measures, but the benefit is that you've got folks there to help you, and we also provide access to an online data entry and reporting system into which you can put the data that you collect that helps you select samples from a roster of your enrolled youth, that provides reports back to you, so you can use the data to monitor your success and inform your stakeholders and many other functions. So we do charge some pretty modest fees based on the size of your organization to license the tools just so that we can keep the lights on, keep our staff helping folks to use them. And I think we already answered another one of the questions, which is what is the availability of the tools? We would love to just kind of send them out to everybody, but we do want to have there be a kind of an agreement for review and use of the WIS and WISB, those standards tracking tools. But you saw in the chat box that I did provide you a link to the actual document that describes all of the wraparound standards on which those tools are based. So right now you could go look at the standards themselves if you like. So that's a few process questions. Sorry to hold you up, John, but I do really looking forward to this thing that's been very exciting, which is learning from our tools at a research level.
All right. Well, thank you. Yeah, so I'm basically going to try to pull together where Eric laid the framework and foundation, and then Philip and Shannon kind of filled in some of the details in terms of the kinds of measures we have. So I'm just going to provide a couple of examples of ways in which we have actually taken a look at putting these disparate data sources together to learn more about wraparound processes and the kinds of supports we might need and what we can learn about the processes, the outcomes, and whatnot. Philip, I'm not sure if I control or you do, but we'll try. Anyway, we're on the next slide, so perfect.
I'm going to control it.
Philip will advance for you. Just let him know when you need him to advance.
Perfect. Excellent. All right, so one of our studies, actually, this is a recent study that our group conducted that's currently under review for publication, we learned that there are differences in sort of some of the outer setting pieces. So we were looking at kind of administrative structures and how those impacted fidelity scores as measured by the COMET, one of the coaching measures that we've already talked about today. And what we found is that when you states that use, this is aggregated across multiple states, states that use a CME structure, so a care management entity structure, had higher levels of fidelity than those that used a more traditional community mental health center, CMHC center approach. You look at state level, there's differences. Of course, there's, some of the CMHCs are a little bit higher, some of the CMEs are lower, but this is the aggregate across the states. So we wanted to look a little bit deeper into that. That's what I want to give an example today. Phil, if you want to go to the next slide. Thank you. So we began by applying some of the SIC, and this is a project that we just are rolling out, but these are some pilot data. So today what I'm going to present are just preliminary data from two states, a CMHC state and a CME state, just to give you some ideas about how these different measures can be used. The data that we gathered from them can be used to learn about these processes under this large outer setting, kind of amorphous, influence that we would say, that the CMHC and the CMEs represent. So what we see here is at the beginning, when we look at those early stages, stage 1 and 2, that engagement, the feasibility assessments, both states are kind of cruising along around the same rate, but these are time to completion data, and they show that when we get to stage 3, 4, 5, and beyond, the CME state is more efficient. It's getting these things done at a quicker rate. The CMHC state is completing the tasks, but it's taking months longer, in some cases years longer to complete. So Phil, if you want to go to the next slide. Just like the first slide that I showed, we see when we drill down to these two individual states, we also see differences in fidelity scores. The CME state, which is quicker to completion on the SIC instrument, is also showing higher levels of fidelity. Okay, next slide. So now I want to talk about how we can kind of bring in different pieces of our data. So we have our outer setting, which is the CME, CMHC. We learned about some of the processes at that larger level. Now we can start to drill in. And this is where we can bring in some of what Shannon had talked about, the WISP data. So this is looking at provider level, organization level data, and I'm just drilling in on the CMHC state alone here, since we're seeing that a little bit slower to implement, and also seeing that that we see those lower fidelity scores. We can start looking at organization level data to learn a little bit more about what's going on in terms of those processes. So you see across most of these subscales, fairly decent scores, between 70 to 80%, a little bit more, a little bit less. But I'm going to hone in on a couple of them, the accountability mechanisms and leadership, which are really hovering around 50% or less. And if you can go to the next slide, Philip, we can then go to item level. And I know this slide is fairly small, so it's hard to see the text, although we're all on our computers really close to your faces, I suppose. But you can start to learn about some of the individual item levels. Where is the CMHC state really thriving? Where are some areas where the state could use a little bit more support? So just as an example, if you can't read, a microscreen resolution is actually fairly poor, so I cheat by having another screen next to me. But if you look at under leadership, which is one of those areas in which the CMHC states seem to struggle a little bit, you're hitting around 50% on most indicators, but the top item, this is executive leadership, supervisors, care coordinators routinely engaged in discussion around implementation. So that's an activity that's not happening. If we go down to the bottom, we see the accountability mechanisms, another broad area in which the CMHC state appear to not be hitting all of those points. They're doing a great job, 100% on tracking child-level outcomes, having processes in place to do that tracking. But then you look at things like having an EHR in place, so processes in place to share data elements. Those pieces are not present. So with these data, to kind of piggyback on what Shannon had talked about, this sets the stage for some coaching, for some support. It's identifying those areas of need that we can then bolster based on where we might see some of those differences across these different states. Let's go to the next slide, Philip. So just some basic conclusions. So this little case study, very simple. Like I said, we're in the process of expanding this to different states and to look more broadly. across the United States and learn a little bit more. But you start to see how we can use implementation process data, using that stages of implementation completion measure, the SIC instrument, to understand variations in fidelity scores. We also can layer on some of our other measures. In this case, we use the WFAS to understand some of the intersetting and how that might be used to support the CMHC states, or any state for that matter, to improve processes, to identify what's going well, where you might need some extra support. Now, other places, actually our team is going to engage with some of our NWIC partners tomorrow to dive down a little bit deeper and see how we can take other kinds of sources of data. And we can look at training data. Implementation science has a large emphasis on workforce development. So what does the IOTA say? How can we bring the IOTA data in to learn about processes and how we can support implementation? How can we take a closer look at the outer settings, to learn more about what is different about from the CME to the CMHC state? What kinds of processes at the systems level might we be able to address? A little bit harder to address system level outer settings than it is the inner setting, but it's important to do. We also can look at other forms of fidelity. Philip went through our with the easy data, our dark data, the TOM, other kinds of outcomes in terms of fidelity, and then ultimately youth and family outcomes. Many states collect the CAMS, the CAFIS, Ohio scales. And we're starting to engage with certain states to dive deeper to look at those outcomes that we're ultimately interested in. But back to Philip's previous slide. Philip, if you want to go to the next slide, revisits one of his previous slides. The specific measures we use, as Philip pointed out, are going to depend on where we are in the process. So oftentimes we're most interested in those outcomes. But as you see on these charts, sustainment is really, we need to be further along than pre-implementation or implementation to start reaching outcomes. So we can start at pre-implementation using the WIS, the SIC, the WIS-P, and then we move into implementation. Actually, those three should still be on that slide as well. But then we can start to look at fidelity. How well are we implementing? And then ultimately we get to outcomes. And that might be, as you saw in that SIC data for that one state, that might be months or years away before we have all those pieces in place to start to look at the outcomes. But hopefully this gives a little bit of an idea of ways in which we've started to and the ways in which we hope to continue to engage these different measures and learn more about the processes across all these different phases. So I'm going to stop there and pass it back to Philip to kind of wrap up and tie some of these other ideas together.
Yeah, and we're pretty much done here, but just wanted to mention that we have a couple handouts and kind of supplemental materials here for you all. So this isn't, we'll make this available. This is just a screenshot of part of this document, but this is something that reviews, again, kind of the different tools that we have, and then based on whether you're an NWIC kind of partnering entity or whether you're non-NWIC, how you might use them, and then kind of across the different phases of implementation again. So this will be made available to people. Sarah may be able to post it to the chat now. If not, we will include it in a follow-up email with the recording of this presentation. And we'll also share with you kind of our comprehensive CFIR model across those phases of implementation diagram. Again, because one of our main goals from this presentation is to further clarify to people how all of these different measures and tools tie together and how we kind of envision them being used to help walk you through the process to eventually having high quality sustainment and positive outcomes for youth and families. And with that, I think I can maybe hand it to Eric and then we can tie things up here.
Thank you all so much. So kind of remarkably, we ended more or less on time. Thanks to John for sharing some of the more recent examples of just a couple of pieces of knowledge that we have gained from this opportunity that we get by using a framework to kind of hold all of these different pieces of measurement. It feels overwhelming for understandable reasons. One of the kind of knocks on implementation science is kind of this overemphasis on the technocracy and a lot of jargon that exists around something that has been done for decades, just putting a lot more kind of terminology and measurement strategies to things that are really just commonsensical, which in systems of care is exactly that. It's what Bob Friedman and Beth Struhl wrote about, 35 years ago, I think, at this point. That if you want to achieve better outcomes for youth who have the most serious and complex needs in their families, you really do need to take a system-level approach that also engages organizations to be part of that systemic collaborative approach on behalf of these kids and their parents and their caregivers. The presentation that we just gave takes a little bit of provides a little bit of an insight into how those folks who are doing active implementation support for something like wraparound care coordination tries to mobilize that very jargony, technocratic kind of world of implementation science and actually make it real for the work that we do. It is remarkable to see when we start with a state or a system of care, a county, whatever it may be, how it can feel a little bit intimidating to have these folks who are providing training and technical assistance come in and describe all these ways in which we're going to use data to keep on track. But what's really remarkable is that, again, it really just aligns with common sense and provides a kind of a number of yardsticks to help people actually review how well they're doing. And it can be incredibly reinforcing to look, for example, at those wraparound standards data at a system level and say, X state that we've been working with for a year, look at this. When we started, we collectively rated your capacity to implement wraparound care coordination in a true system of care fashion as being pretty primordial, pretty low. And 1 year later, thanks to the hard work you've been doing, engaging your system partners, your family organizations, the wraparound provider organizations, you've now achieved, X% of readiness to implement wraparound, and we're ready to move to implementation with gusto. Those kinds of dashboards that we provide can be incredibly powerful and useful. So it all comes down to people working together on behalf of the individuals that we're here to serve. I don't know what else I have to say in terms of a wrap-up. I don't see any other questions. Did Philip or Shannon see anything that I have not addressed in some of those basic points about, yes, the webinar is going to be available. I will also type in where you can go to find the Wraparound Fidelity Assessment System tools and the terms of use, or maybe Philip can type that in. I'm pretty sure it's...
There's a last poll I think we could still do since we have many of our...
yeah. Why not? So since folks are still on, before we go, let's ask a little bit about what you have learned and if you have any interest in taking these ideas to the next level. So here's the poll question that we will take a look at before we conclude and let folks get on with their Wednesday. Which of the following domains would you be interested in measuring throughout implementation of wraparound? And, don't feel compelled to check every one. What do you think, based on your current experiences with your wraparound initiative, where would you start? What would be one or two, even though you can check as many as you like, that you feel like you're not doing now that you would like to zero in on more so that we can have a little bit of a sense as to what we need to emphasize in the future at National Wraparound Initiative and National Wraparound Implementation Center? What are the domains that your initiative or state or wherever you're working would be interested in measuring anew that you're not currently? We know that there were several that people said that they measure much less frequently among these kind of categories of implementation support that we presented along the way. Do you want to get at kind of a systematic assessment of your system, your policies and funding context? Do you want to take a look at your organizational culture and caseloads and supervision characteristics and so forth? A big thing we've learned along the way at the inner setting level is how critical it is to have firewalls between the care coordination unit and other service delivery tracks, that it's really critical that organizations find unique supervisors for wraparound care coordinators and that they're not being pulled in multiple different directions, the supervisors or the care coordinators. So that's an inner setting characteristic that gets measured with our tools. And interestingly, as I was saying that, and I think this happened before I started talking about it, one of the ones that really popped up among those that aren't currently being measured is the inner setting. So that's real interesting, and the process. So that's a little bit of a call out, shout out to our colleague Lisa Saldana at Oregon Health Sciences, Oregon Social Learning Center, who developed the stages of implementation completion. That yes, it is important to kind of keep track on the timelines and the milestones of implementation. And that's in the implementation process. That's up there with the inner setting that people have voted on. So that's pretty cool. Really neat data. Interestingly, it's kind of across all 7 of these domains that people are saying that they want to kind of focus more on. So I'm going to, Shannon or Philip, any last words you kind of want to put out there? Again, I don't see any other questions we haven't addressed in the chat. I just put in there a website, a URL that I think you can go to get to the Fidelity tools I had provided previously, where the standards are, where the webinar, archived webinars are, and so forth. Any closing words?
No, just point. There were a couple of questions. I got a couple of questions from folks that couldn't find my email. I did put it in the chat box, but it is here on this slide. You can see it right here. Or you can always just do NWIC at schools@ssw.umaryland.edu. But no, I think it's really interesting.
All right, and hello to all of the folks. Yes, thanks for being so fun with your chat box. Former Californian says hi. Hello Canadians, hello Sweden. We really did have someone on from Sweden, where by my calculation it's about 9 o'clock at night, I think, right now. So Magnus, thanks so much for being with us. All right, everybody. Philip, you want to have the last word? Philip, just congratulations to Philip and Shannon for pulling the majority of this together.
Thank you. And with that, I think we'll wrap it up and I'll hang up. Bye-bye.
Buddy, thank you. Come here.
For the Spanish thing.